housing is a really important element to drug treatment and to preventing relapse. So the important thing here is that when you got that information in 1997, you did something about it. Okay? The same year, HHS published a report on foster care and family reunification. Okay? And in that report, they found out that child welfare nationwide struggles with services matching in every category you can think of. Okay? So just because of the different problems with child welfare, like the financing structure of child welfare doesn't really support what Commissioner Hamilton really would like to do, and that people in DC are working on that. But what this report showed in 1997 was that just any kind of service you can think that a family might need in foster care, they're not necessarily likely to get that actual service. Okay, so for example, if I come in and I have a lack of supervision charge because I'm leaving my kids unattended to go to work, I'm not likely to get child care, even though you would think that would be the likely solution, right? So child welfare has some problems in terms of matching services to the needs that people come to the table with, okay? But of all of those things, housing was the hardest thing for child welfare to appropriately match. They don't typically have housing resources. And that was reported in 1997. And you got information in 1997. But you're the only state that really took on housing. Okay, so the whole country was alerted in 1997 that this is what child welfare is struggling with. Connecticut took it on, other states were left behind. They did not take it on. That speaks volumes about what you're willing to do, what you're willing to come together and do in Connecticut. Okay, and you did that partly because there was research, but also housing just has, if you look at research, housing has face validity, okay? And what that means in terms of research is if someone is homeless and you give them a home, any reasonable person can look at that. You don't have to be a Harvard-trained PhD researcher to look at that and say, huh, that helped that family. So that is face validity. But the other thing that you've done that's been really interesting over the years is you've taken this idea that you had in 1997 and that you bought on face validity, and you coupled yourself with the University of Connecticut, and now you studied it to go beyond face validity and to get to the actual empirical evidence that it works. Okay. Housing is one huge reason why that works, and that is what the research shows. And indeed, there have been numerous studies around the country that have showed that supportive housing, an investment in somebody's housing helps improve family circumstances. But what I really love about the UConn research is that it gives credit where credit is due, and that is to the amazing staff that you have. Because they've looked at, bravo. And unlike most researchers, Ann Farrell and Preston Brittner get that that is the important element. So they're not looking at, do you have a BSW and 2 years of experience? No, they're actually measuring client engagement, the ability that you are able to capitalize on what these wonderful mothers bring to the table and bring that out of them. Give them what they need to help them be great parents. And it was Lainey's mom, Joanne, who said, you help the mother. You don't try and parent our child around us. You help me become a better parent. Not every case management program understands that, and certainly not in child welfare, right? So that is a huge element, and so you cannot make that happen if you don't have case managers that get it, and you do. And I have yet to meet the case manager that works here that just doesn't immediately just make you feel like they have an authenticity and just a genuine interest in your well-being. So that's what I love about the connection. So I have the opportunity now, because we have this national center, to talk to people all over the country about what they can do to help families. And the interesting thing is, now that we have the empirical evidence that housing works, so we could have made the moral argument years ago that you should be housing families who are separated because of housing, okay? You could have made the face validity argument. But partly because of your work at UConn and other researchers that have sort of gotten up to speed now, we have the empirical evidence that we need. So now research is driving me to get all these phone calls from people around the country. Unfortunately, because the moral argument, 10 or 15 years ago wasn't enough. But now we have the empirical evidence. So I'm getting all these calls. I don't think I've ever gotten a call at the National Center for Housing and Child Welfare from anywhere around the country. And we get calls, we do technical assistance for 40 states for the Family Unification Program the last go around. I don't think I've ever had a conversation, you should send me a bill, because where I haven't mentioned the connections work. And right. And people say to me, you're out of your mind. That's not, no. And certainly child welfare is not partnering up on that. That's not happening. call Stacy Gerber, call Kim, call these people, and actually it is true that there are child welfare people out there that really want to make an investment in housing. So having actual human beings that I can put people in contact with, that is what makes the difference. But yeah, you should send me a bill, Peter. Okay. So, I'm going to make sure I'm not going too long. Okay, so I think I should probably close. But I just want to say this. I want to say thank you to the state of Connecticut. I want to say thank you to all of you guys in the room, because I realize that it's not just the connection, but of course, you know, your name kind of says it all. You have been the leaders in bringing all of this together. So I want to thank you for doing that, for just bringing people together, okay? But I have a hard time believing that any of this would have happened if DCF hadn't been involved. So I want to thank you, Commissioner Hamilton, for, and Stacy and Kim, because you get it, okay? And I deal with a lot of child welfare people. I'm just saying, okay? Hello. Yeah, say more. You know what I'm saying? So yeah. So, but you get it, and that matters, because like I said, a very high-level person who should understand child welfare asked me why we named it, what our agency even meant. Okay, so it really makes a difference. And again, you can see where HHS hasn't really taken this on. Okay. So I want to thank you for what you've done here in the state of Connecticut, but that means 1,600 families. That's going to mean more families, because you've housed 1,600 families over the life of the program, and I feel like your tentacles reach out much, much farther than that. Okay, that's just the ones you housed, not the ones you stabilized in other ways. But you're going to serve more. But that isn't even a scratch on the surface of all the families and children that you've helped nationwide by allowing us to put your model out there and traveling around to train people, because people all over the country are now trying to do what you do. And so I congratulate them for coming along, and I thank you for putting it out there, but my God, you told people to do this 10 years ago and they're just now coming along. So that kind of makes me sad. But I think that even just over the last 2 years, many states have taken on, as far away as California, have started to take on what you do. So I really want to thank you for everything that you've done for all the children and families in America that are going to benefit from your model. So with that, I'll close.